Hi, I'm Irene Andrus, and today I'm doing dispatches from the front line. I'm profiling the role of the patient flow coordinator in supporting effective, high-quality patient flow through our organization. I'm with Jess Scott in the patient flow office today. Jess, can you describe the role of the patient flow coordinator, and specifically, what does your typical day look like?
The short answer for what a patient flow coordinator does is to get the right patient to the right place at the right time. Might sound pretty simple or straightforward, but it is anything but that. A good example of a challenge, we're in surge today, which means that we have more admitted patients in the emergency department than we have beds on the inpatient units. There's competing priorities, so you want to be concerned with the fresh patient that has just come in that needs immediate care, but you can't forget about the patient that you're trying to progress through to get home, from physicians, physiotherapists, occupational therapists, and home care. So it's to engage all those people. It's all hands on deck to make sure that our patients are progressing through their hospital journey appropriately as the new patients are beginning theirs.
Jess and the patient flow team attend our huddles, and this is helpful because sometimes we have patients that are ready for discharge, but the only thing holding up their discharge may be a test or a procedure. They're able to expedite that process, which is helpful, and it gets the patient where they need to be sooner.
In addition to participating in rounds throughout the hospital, Jess also attends an alternate level of care, or ALC, meeting once per week to discuss the needs of this complex patient population. Can you tell us what the ALC huddle is intended to do in terms of your role as a flow coordinator?
So we're looking at patients that are currently in the hospital, but medically don't really need to be here. They do have other complex social concerns, whether it be around supports or medical needs that can be managed in the community. But it often takes time to organize and plan and identify what the true barriers are to them returning home.
Addressing the needs of our alternate level of care patients is critical to seamless patient flow and ensuring the right patient is in the right bed at the right time. Today we've profiled how our patient flow coordinator works with our interprofessional team within a larger healthcare system to support effective patient flow. I'm Irene Andrus, Chief Nursing Executive from the Michael Garron Hospital. Thank you for joining me today.